All right, new information throwing a bit of a wrench into what most women think they know about their own health. Researchers at Harvard Medical School say women under the age of 50 should be encouraged to get regular mammograms. Problem is that contradicts previous recommendations. So what are you supposed to do? Dr. Semine is the chief of breast imaging at Newton-Wellesley Hospital. Thanks for being with us this morning.
Pleasure.
So a bit confusing for women, as you can imagine here. The study that came out of Harvard basically said that they looked at the records of about 600 women who died from breast cancer. 71% of them who died were not screened. Half of the women in the study died before the age of 50, and their conclusion then is that women should be getting screened regularly before 50, which of course, as I mentioned, contradicts what women think they know. What's your reaction to that finding?
Well, this study actually supports a number of other studies that have demonstrated value to screening in women in their 40s. The truth is that screening detects earlier cancers. Screening allows better treatment of cancers. And women in their 40s have cancers that may grow faster. Because of that, it's even more important for them to be screened on an annual basis. And this study from back in the 90s demonstrates a significant difference in terms of those women who die of cancer being those who were not screened.
So you would support then the screening before the age of 50?
Absolutely. It's very valuable, and that's been demonstrated very convincingly.
So what are the criticisms here to the previous recommendation of saying that you should wait till you're 50? Why wouldn't you get screened earlier if it could help save your life?
There is no good reason to wait. I mean, the only considerations are financial, and I think that by demonstrating this kind of survival advantage, there's no question that it has value and it does work.
So would you say that that previous recommendation, and it was federally funded but done by an independent group, the recommendation that said that you should wait till 50, would that have been motivated by insurance?
The motivation there, I think, is well-intentioned, but I think it's just a poor assessment of the data that exists. I think that the detection rate for women in their 40s is excellent. Their conclusions were based on old data, but more importantly, it's just the way they interpreted the data was misleading.
Misleading. Now, you mentioned financially this being sort of a motivation here.
It can be. I don't want to focus on that because I think that there's also a legitimate debate taking place. But the truth is that this data, for instance, was based on an old study. The women were screened back in the 90s. That was even before digital mammography and before 3D mammography. The technology has continued to improve. We're detecting earlier cancers, and there's no question that in treating cancer, the earlier the cancer, the better the result. So
it can be so confusing because the American Cancer Society has said for decades that women should get regular mammograms starting at 40. But then you get, the recommendation in 2009 that it isn't until 50, and it seems like we're hearing something new every few years. So how do you know which group to trust in something like this?
The American Cancer Society never wavered. They have always supported annual mammography for women above the age of 40. A number of other societies have the same recommendations. The controversy has not changed the mind of those who deal with the issue on a daily basis. It is not controversial for those who actually take care of women with breast cancer.
Now, as we look at a bit of a healthcare mandate here that's going to be implemented, does that change things for women? If you don't have any insurance, how expensive is a mammogram?
A mammogram can be expensive, and it's not so much the mammogram that's expensive as what the mammogram may discover that will need to be evaluated and resolved. So that can get expensive. The truth is, there is a mandate for insurance to cover. In Massachusetts, it's not a problem because coverage is pretty much universal. And on those rare circumstances where someone does not have insurance, there are programs for women to get their mammograms and have that covered
I see.
Separately.
I want to ask you one last thing before we let you go here. The previous recommendation was if you do wait until 50, it's every 2 years that you get a mammogram. But I imagine that if you're telling people to get them younger and those cancers grow faster, they should get them more often?
Annual mammograms really should be the interval, and the reason is the whole point is to detect breast cancer early. Giving a cancer an extra year to grow is not that wise. It doesn't gain as much as we would like to think.
All right, Dr. Semine from Newton-Wellesley, we appreciate you being with us this morning and sort of breaking it down for the rest of us a little bit. Thank you.
My pleasure.
All right, we got to take a break here on the Fox 25 Morning News. We'll be back after this.